Which muscarinic receptor subtype slows the SA node? M2. Remember, M2 means minus heart. Drug of choice for atropine toxicity? Physostigmine. Remember, physo fixes atropine. Depolarizing neuromuscular blocker causing fasciculations then paralysis? Succinylcholine. Remember, suck first shakes then stops. Irreversible organophosphate antidote that reactivates ACHE? Prilidoxine. Remember, PAM pulse phosphate. Preferred drug for anaphylactic shock? Epinephrine. Remember, epi ends anaphylaxis. Selective beta-1 blocker safe in asthma? Atenolol. Remember, atenolol avoids airways. Irreversible alpha blocker for pheochromocytoma pre-op? Phenoxybenzamine. Speak. Remember, pheno binds forever. Speak. Ganglion blocker producing severe orthostatic hypotension? Trimethophan. Remember, tri makes you topple. Short-acting beta-2 agonist for acute asthma? Salbutamol. Remember, sal breathes soon. VNAT inhibitor causing NE depletion? Reserpine. Remember, reserpine removes reserves. Long-acting antimuscarinic for COPD maintenance? Tiotropium. Remember, Tio takes 2 days. Surface receptor that mediates sweat gland cholinergic sympathetic fibers? M3. Remember, M3 makes sweat. Drug that selectively stimulates alpha-2 receptors to treat hypertension and opioid withdrawal? Clonidine. Remember, clonidine calms center. Selective alpha-1A blocker preferred in BPH with minimal hypotension? Tamsulosin. Remember, tamsulosin targets tinkle. DOC for neurogenic orthostatic hypotension acting on alpha-1? Midodrine. Remember, midodrine lifts pressure. Cholinergic agonist diagnostic for asthma airway hyperreactivity? Methacholine. Remember, methacholine makes wheeze. Drug preventing motion sickness via M1 blockade? Scopolamine. Remember, SCOP stops seasick. Beta blocker with both alpha blockade and antioxidant property used in CHF? Carvedilol. Speak. Remember, break time, carve dual hearts. Depolarizing blocker that triggers malignant hyperthermia with halothane? Succinylcholine. Speak. Remember, break time 100 milliseconds, suck sparks heat. Speak. Antidote for malignant hyperthermia? Dantrolene. Remember, Dan cools muscles. Speak as an A sapphire, oxybutinin. An experiment. Remember, oxy over bladder. Prosody rate 100%, presynaptic alpha-2 antagonist, increasing NE release, formerly as antidepressant. Mirtazapine is commonly used for medication in treatment. Remember, mirtazapine more NE. Short-acting non-depolarizer preferred for hepatic impairment, atracurian substitute, cisatracurian. Speak. Remember, see safe in cirrhosis. Acetylcholinesterase inhibitor used in myasthenia gravis diagnosis? Edrophonium. Remember, Edro tests MG. Nasal decongestant causing rebound congestion on prolonged use? Oxymetazoline. Remember, oxy overuse blocks. Beta-2 agonist with long duration used COPD once daily? Indacaterol. Speak. Remember, Inda daily breathe. Central muscle relaxant inhibiting ryanodine receptor? Dantrolene. Remember, Dan blocks calcium. Alpha-methyl dopa false positive Coombs test due to IgG autoantibodies. Remember, methyl-dopa makes antibodies. Doc to terminate supraventricular tachycardia due to AVNRT acutely, adenosine. Remember, adenosine arrests AV. Which anticholinergic is used to reduce vagal response during carotid sinus massage? Atropine. Remember, atropine avoids vagal. Beta blocker with membrane stabilizing action but not used for that? Propranolol. Speak, remember, break time, prop, no extra gain. Speak, prosody rate 100%, ganglion stimulant present in tobacco, from caps tobacco, nicotine. Remember, nicotine kicks ganglia. Short presynaptic sympathetic neuron releases neurotransmitter, acetylcholine. Remember, preganglionic always ACH. Beta-3 agonist approved for overactive bladder 2015, mirabegron. Remember, mira-beta-3, bladder. Drug blocking any reuptake used as nasal decongestant but cardiotoxic? Ephedrine. Remember, ephedrine elevates pressure. Antidote for clamshell-shaped poison physostigmine overdose? Atropine. Remember, atropine against ACH excess. Alpha-2 agonist used IV for ICU sedation lowering BP? Dexmedetomidine. Remember, Dexmed sedates safely. Doc to prevent vagally mediated bradycardia prior to intubation? Atropine. Remember, atropine before tube. Catecholamine that increases systolic but decreases diastolic BP via beta-2? Epinephrine low dose. Remember, low epi widens pulse. Selective alpha-1A blocker with minimal ejaculation issues? Silodosin. Remember, silo spares spill. Muscarinic antagonist used pre-op to dry secretions? Glycopyrrolate. Remember, glyco keeps mouth dry. Reserpine causes depression by depleting NS, serotonin and catecholamines. Speak. Remember, reserpine drains mood. Nicotinic NM receptor antagonist used as skeletal muscle blocker derived from curare? Tubocurarine. Remember, tubo blocks tubes. Pseudo-E of NE release blocker acting on adrenergic neuron endings historically for HTN? Guanethidine. Remember, guanethidine guards NE. Beta-2 selective agonist used for premature labor? Ridodrine. Remember, Rido relaxes uterus. Drug causing cheese reaction with MAO inhibitors due to tyramine displacement of NE. Tyramine. Remember, tyramine triggers crisis. A speak prosody rate 100, shortest acting beta blocker used IFI for emergency arrhythmias. Break time of 500 milliseconds. Esmolol. Remember, esmolol ends fast. Muscarinic antagonist topically for cycloplegic exam lasting 6 to 8 hours? Cyclopentolate. Remember, cyclopans pupil. Speak, dicyclomine used in irritable bowel acting on N3. Remember, dicyclomine dulls cramps. Selective alpha-2 agonist used for ADHD in children? Guanfacine. Remember, guanfacine guides focus. Indirect sympathomimetic used illegally in sports-enhancing alertness? Amphetamine. Remember, amps mind. Beta blocker with ISA causing minimal resting bradycardia? Pindolol. Remember, a break time 100 milliseconds, Pindol partial pause. Alpha-1 selective blocker causing retrograde ejaculation? Tamsulosin. Speak, remember, 1. Tamsu, reverse flow. Remember, suck spikes potassium. Which drug combination is recommended to reverse deep rocuronium block rapidly? Sugamadex, IV 16 mg per kilogram. Remember, sugar rescues rock. Doc for severe tetanus to control rigidity, diazepam. Remember, diazepam dampens spasms. Beta-2 agonist long-acting twice daily for asthma, salmeterol. Remember, salmeter 24. Alpha-2 agonist eye drug reducing aqueous humor and glaucoma, brimonidine. Remember, Bremo brings pressure down. Drug causing dry mouth, blurred vision, urinary retention, collectively called anticholinergic syndrome, atropine overdose. Remember, atropine dries body. Selective M3 antagonist, newer for urge incontinence once daily, darafenicin. Remember, dairy detrusor damp. Doc for cyanide toxicity, secondary to nitroprusside, sodium thiosulfate. Remember, thiosavecyano. Which adrenergic receptor mediates lipolysis in adipose tissue? Beta-3. Remember, beta-3 burns fat. Ridodrine is replaced by which calcium channel blocker for tocolysis? Nifedipine. Remember, knife stops labor. Selective beta-1 agonist used in acute decompensated heart failure for inotropy. Dobutamine, Prozody. Remember, Dobu boosts beat. First, synthetic non-catecholamine direct-acting sympathomimetic, phenylephrine. Remember, phenyl first non-cat. Drug causing dose-dependent shift from beta to alpha stimulation, epinephrine. Remember, epiflits alpha later. Competitive antagonist of nicotinic receptors used as smoking cessation, varenicline. Remember, varenicline vetoes nicotine. Beta blocker safe in renal failure due to hepatic clearance, propranolol. Remember, prop passes liver. G protein type coupled to M2 receptor, GI. Speak, remember, break time 20 seconds, M2 goes GI. Rate limiting step in NE synthesis inhibited by metarizine, tyrosine hydroxylase. Remember, metirosine blocks tyrosine hydroxylase. Physiological tremor in elderly worsened by which beta agonist drug? Isoproterenol. Remember, iso intensifies tremor. Which enzyme metabolizes catecholamines in neuronal cytoplasm? Monoamine oxidase. Remember, MAO manages monoamines. Catecholamine metabolite measured in urine for pheochromocytoma? Vanillomandelic acid. Remember, VMA verifies tumor. Reversal of anticholinergic CNS toxicity uses physostigmine because it is soluble. Lipid crosses BBB. Remember, physo passes brain. Which autonomic drug causes mydriasis and cycloplegia? Both, atropine. Remember, atropine pupil paralysis. Drug that blocks choline uptake at nerve terminal, hemicolinium. Remember, break time, hemi halts choline. Muscarinic antagonist used in Parkinson disease, trihexyphenidyl. Remember, trihexy tames tremor. Which beta blocker has additional ISA and can be used in bradycardic hypertensives? Aspetalol. Remember, aspetalol adds beat. Doc for cyanide released by nitroprusside besides thiosulfate? Hydroxycobalamin. Remember, hydroxo hugs cyanide. Speak, prosody rate 100%. Which drug inhibits catecholamine storage in vesicle besides reserpine? Break time 1500 milliseconds, tetrabenazine. Remember, tetra bans vesicle. Alpha-1 blocker causing first dose syncope mitigated by bedtime dosing, prazosin. Remember, prazosin, pass out. Long-acting non-depolarizer eliminated via Hofmann degradation, atracurium. Remember, ATRAC auto-brakes. Which sympathetic nerve endings enzyme converts dopamine to norepinephrine? Dopamine beta hydroxylase. Remember, DBH does dopamine. Muscarinic antagonist patch for COPD applied every 24 hours? Umeclidinium. Remember, UME 24. Speak, prosody rate 100%. Beta-2 agonist causing uterine relaxation, but discontinued for maternal tachycardia. Break time 1,500 milliseconds. Terbutaline. Remember, terbutaline tames uterus. Selective alpha-2 agonist colonic analgesic used in IBS, lofexidine. Remember, lofexidine lowers gut pain. Muscle relaxant antidote neostigmine should be co-given with antimuscarinic, glycopyrrolate. Remember, glyco guards heart. Which inhaled anticholinergic has onset 5 minutes and duration 6 hours, useful rescue COPD? Ipratropium. Remember, Iprat quick short. Speak, doc for neonatal myasthenia gravis transient, neostigmin, process. Remember, neo nurtures neonate. Eta blocker with highest lipid solubility causing vivid dreams? Propranolol. Remember, prop produces dreams. Which cholinergic agonist selective for nicotinic receptors at NMJ? Decamethenium. Remember, decadipole NMJ. Doc for pheochromocytoma intra-op hypertension crisis, phentolamine IV. Remember, Fento fixes surge. Peripheral acting centrally penetrating alpha-2 agonist causing sedation side effect, clonidine. Remember, clonidine causes calm. Which reversible anticholinesterase preferred for postoperative ileus? Neostigmine. Remember, neo nudges gut. Drug preventing urine retention after spinal surgery via M3 agonism, befenacol. Remember, Beth bladder start. Long-acting sympathomimetic present in nasal drops causing tachyphylaxis, xylometazoline. Remember, xylo exhausts nose. Doc for cholinergic crisis in myasthenic patient overdose, atropine plus ventilatory support. Remember, atropine then air. First non-benzylisoquinolinium steroidal neuromuscular blocker, rocuronium. Remember, rock rapid steroid. Which drug combination is contraindicated with beta blockers for AV block risk? Verapamil. Remember, verapamil plus beta bad. Cardioselective beta blocker with NO-mediated vasodilation, nebivolol. Remember, nebi makes no possible.